Hi, welcome to the Brain Injury Alliance of Iowa's Casual Conversations for 90 Days of Advocacy. I'm Jeffrey Lauer, Executive Director of the Brain Injury Alliance, and today I am honored to be able to bring you Senator Mark Costello from the Iowa Legislature. Senator Costello grew up in rural Imogene, Iowa. He's worked in a number of areas, but as a computer programmer analyst with Garceed Company. And then after about 5 years, he returned to the family farm where he and his wife, Rachel, reside in Mills County, and they raise children, corn, and soybeans. Senator Costello was elected to the House in 2012, representing then House District 23, and was elected to the Senate in a special election in 2014. Senator Costello serves in a very powerful capacity for people with disabilities as the chair of the Health and Human Services Appropriations Subcommittee, as well as on the Senate Health Policy Oversight Council. Senator Costello, you've got a 2.5 hour or so commute back and forth when you go home. And so in addition to serving Iowans in your capacity as a senator, I just want to thank you for taking that route in a gnarly Iowa winter this year. So please drive safely when you go back and forth.
Thank you.
So welcome. So today, Senator Costello, I was hoping we could just take a few minutes and ask you what your feel is of the appropriations landscape. Is the Appropriations Committee faced with a dire constraint? Is level funding in many, if not most programs, a possibility? Do you have degrees of freedom to increase funding around critical areas for people with brain injury and or other disabilities?
Well, last year we were trying to look at some increases in some areas, and then COVID hit, and most everything ended up at status quo funding. And fortunately, we had enough money to adequately cover that. So we had a little bit of surplus coming into the year. So we do always like to keep our spending below our ongoing revenue. So we like to try and find one-time spending opportunities for maybe that where we have a little bit of surplus and save where we know we have ongoing revenues for what we add increases, so we can make sure that we can continue to fund those and not have to make cuts and that sort of thing. So I feel like we have the revenues have not been great, but we have increased capacity to spend. So I'm looking for some increases in some of our key areas. Yes, this year the government has put in several areas some new money and that's always good when we get included in her budget. It makes it much easier for us as the legislature to increase the funding there. So we will have some areas where we are able to have some increased funding.
Well, thank you.
Yeah, we haven't set supplemental state aid for schools yet, and that will tell us a little bit. That's always a big chunk of money that we have to try and decide. Go from there with what we have left after that. We reserve money for that, let's say.
Well, historically, I know that this is kind of in that too early to make those calls about appropriation capacity. But I do want to just take a minute and ask, what your feeling is for the Iowa Medicaid program, the managed care program. There are many people who are concerned about Medicaid having adequate funding, particularly around provider and individual reimbursement rates, because Iowa has so much turnover in that area. And what we hear from individuals on the ground is that happens to them as well, particularly if there's a challenge, if they have family members or they're individuals with challenging behaviors, it can be difficult. What's your sense of what might happen this year, if anything, with Medicaid modifications and or funding?
Well, I think we have some hopes that for PMICs are going to receive a good increase. We have money for our rates for home and community based. I'm encouraged that we're going to be able to do some increases there, which I was hoping to do that last year, but the COVID stopped everything.
Yeah.
I guess there's some mental health money that the governor has set aside that I don't know what she has in mind for that. I have not, I made a couple of appointments that we had to cancel or they had to cancel. So
Sure.
I've not been able to figure out what she has in mind there. I don't know where that will be going.
Good.
So there are some areas where we have some increases. There's some things that I feel like we might need to do. There's some different things with child care that we're looking at, and trying to figure out what the best way to use that money is.
Yep.
So I guess
Anything you think can be managed with the Medicaid waiver waiting lists?
well, I mean, I thought we pretty much had the brain injury waiver. We're trying to work on that.
Yeah.
And so I don't know. Honestly, I'm not super optimistic that I think we need to work on the rates first. And
Okay.
then try and start on those waiver lists.
Fair enough.
But there might be some opportunity. I can't promise anything though on that.
You know, Senator, if there's any COVID money that might support a strategic initiative. COVID-19 is now well documented for people who survive either with mild disease or moderate severe. With this 10 to 45% of people with long haul syndrome, which include neurological and other vascular changes, brain fog, memory issues, mood changes, risk of losing employment. It's being referred to as kind of the second pandemic that we'll have to address after we've got the first one under control. Do you have a sense that there's a way to build capacity for that in this year's budget, or maybe in the coming years?
You know, Jeffrey, I haven't thought about that yet. I haven't had anybody else talk to me. I mean, I'm aware of the brain fog issue for some people. I personally know some people that have been suffering with that. I think they've been getting better. So I'm hoping it's not something that's going to be permanent. But what do you know about that? What have you seen?
Well, what we're seeing is that it's in a significant portion of people. And again, we've only had this pandemic for a year, but these conditions are lasting more than 6 months for people. And what we know about brain fog or any other kind of brain-related injury is that early intervention with specialized and intensive supports is the only thing that's ever made a difference for people in those early days. We have that experience from mild traumatic brain injury, which is from concussion, and most people recover from concussion just fine. There's a handful, not a handful, actually, it's quite a significant portion that have a complex post-concussive world. Now that's not COVID. COVID has a different causation that the medical community is still trying to figure out. But the realness of now percentages, we've got 25 million Americans who've survived COVID. And if 10 to 40% of them have outcomes, which we're starting to get at the Brain Injury Alliance referrals, and On With Life, for example, has opened up a specialized COVID-19 recovery clinic, there's going to be a need for people to have ways to accommodate and adapt to changes in their cognition after this. And so forgive me if that's the news to you. I can certainly provide additional information on that. It's a looming thing across the country.
Yeah. I guess, I don't know. We probably better try and figure out what the best way to address that would be.
Happy to be part of that solution as we go forward. I know you've got just another minute or two left. Are there any other thoughts that you have regarding, the legislature this year and where you see significant opportunities that you and your colleagues on the Health and Human Services Appropriations Committee have?
Well, I mean, it's just a little bit different because we do have a lot of money for, the COVID relief money, and trying to figure out where that's all going to be gone to. And certainly this is something that the Department of Health and Human Services is working on, the governor's office is working on. It's not so much an area that I'm working on, but I'm just looking for them to say, okay, here's where we have been able to get money, and here's what we're doing with it, and try and figure out where we need to step in and meet the needs that money is not able to provide for. And there's regulations on what that can be used for. It gets all rather complicated, and it's not something that we are working on directly because they're already working on that. We just have to that's their responsibility as the administration to do that. But clearly we need to take that in consideration, and if there's needs that can't be used for that we see, we'll have to try and address that.
Fair enough. Maybe I could ask you, just based on us showing up and providing rapid, relevant, reliable information. We've already reached out. I know that in this time of the COVID pandemic, focusing on prevention and managing COVID vaccinations is overwhelming and needs to be the primary focus. However, we've asked for having a place at the table to kind of bring the medical expertise from around the state and around the country. Perhaps as you talk to the governor's office, you might also say, hey, there's some resources here at the Brain Injury Alliance. These guys are watching the radar screen. We can bring additional information to bear. It's probably too soon to do anything this month, but by this time next year, it probably won't be too soon. And so getting ready obviously is better than trying to react after the fact.
Sure.
Yeah. Well, thank you so much for taking some time with us today. I'll certainly be circling back with you over the course of the session. Very much appreciate your years of service and your awareness and your personal connection, which you'd shared in the past with how this walk walks with your family. So again, Senator Mark Costello, Senator from Mills County, joining us today for part of our 90 Days of Advocacy. I'm Jeff Lauer. Thank you so much, Senator.
Thank you. It's great to visit with you again.
All right.